Earlier this year, Governor Patrick began a campaign to help a growing number of people struggling with obesity. It's a health problem that leads to more serious problems. There's also a chance to solve the problem by making changes in diet and lifestyle. To tell us more is our guest from the Mass Department of Public Health, the Manager of Ethnic Media Engagement. We'd like to welcome Jordan Corriza. Thank you very much for being with us.
Thank you, Chris.
First of all, you call this an obesity epidemic. Is it really that bad?
It is, and it is across the nation as well as in Massachusetts. I've got some numbers to tell you. In Massachusetts, even though Massachusetts compares favorably to other states in its rates of overweight and obesity, Massachusetts has seen in 10 years, in a decade, an increase of 47% of overweight and obesity the population, whereas in the country in the same period it has been 40%. So this is what makes us think that we need to do something quickly to address this problem.
And by the way, we're not just talking about what happens when people hit midlife or get older. This is something that can really be a serious problem even when we're talking about teenagers and kids.
Exactly. It can be at all ages. In fact, in Massachusetts, more than half of the adult population is having either obesity or overweight. Kids in the public school system, we're also seeing some numbers that are a little bit troubling. And in fact, kids in school, almost a third of all children in school are actually having this problem. I think it's also worth to mention that the problem of overweight and obesity in Massachusetts is not affecting everybody equally. For example, in the high school student population, 22% of the African American high school student population is overweight and obese, whereas the Hispanic high school student population is 15%, and that compares to 9% of whites. The adults numbers show also a disparate effect of this problem in the population, so I think it's worth mentioning that there are disparities around this as well.
First of all, let's start with the disparities. Why do you think we see those numbers?
It's really hard to tell because the problem of overweight and obesity is not a single cause, I don't believe. There are many factors that play into the reason why a person has this problem. I think we could go on and on talking about environmental factors, nutrition, poor physical activity and exercise, a sedentary society, as they say. And in fact, part of the Mass in Motion, which is this initiative that the state has launched, is focusing in many areas, but the website that we've built at the Department of Health is focusing on personal lifestyle changes, so nutrition, better nutrition, and physical activity.
By the way, are there really that many choices of people with nutrition? Because sometimes the kind of food that's really good for you might be a bit more expensive, or it's not as readily at hand as it may have been, let's say, in immigrant families. They might have grown up with stuff growing in the backyard, so
True.
Here it's not that easy.
True. That's true. And what this the resource that that the state has put out there addresses that as well. In fact, I should say that the entire initiative, which has several components to it, programmatic components and policy components, is trying to address that in different ways. I guess I should mention that one of the components is a number of grants that are being given to cities and towns. There is about $750,000 that are being given to cities and towns so that they can tailor different programs for their communities. We realize that each community is different and they have different needs, and some of what can be done with this money at the community level, for example, is bringing farmers market closer to certain communities, planning better so that we can build more supermarkets, and people in those communities, inner cities especially, will have more access to healthier foods.
One of the features you have is a blog. And this made me think of the food because somebody wrote on the blog about the Haymarket, right, which has some nice bargains, which I didn't know about for many years, but I guess somebody could respond to that and say, I know a place near Rossi Square, or I know a place on Dorchester Avenue.
Exactly. And this is the beauty of the online interaction that we're having with the public. We started with, when we launched the entire campaign, the entire initiative earlier this year, as you said, we had put together a website with all these resources, but then we added on a blog, and it's called the Commonwealth Conversations. And this is a great tool for us to interact with the public. And some of the features on this blog are that, yes, we can put postings up there, as the one you saw with the notice about Haymarket. But people can respond to that. They can make comment about that posting, and they can also share ideas or tell us what's going on in their communities. There is also a calendar on this website where people can send us events that are going on in their community, and we can put it up there so everybody gets to see what's going on around the state.
And I know in Boston we've had a number of these neighborhood walk groups, so I imagine that eventually some of those may be recruiting through a blog like this?
Exactly, they already are, in fact. Yes, and they're posting the walks that are going on around the city and other areas in the state, yes.
There's some other features of the program the governor is putting into play here, and one of them affects the information at restaurants, because a lot of us go to restaurants and we have these things that we tend to choose all the time, but we don't really think about how much they add up to as far as the calories.
Exactly. So another component of the initiative is mandating that chain restaurants, and that is restaurants that have 15 or more locations throughout the nation, post caloric content of their foods. And this is an idea that is not something that happened haphazardly here in Massachusetts. It's something that is being done in other states, and it has shown results. People do, as you said, come up to the register to order something at a restaurant, and they may or may not know what it is that they're the caloric intake of that food, what it is that they're ordering. So we've seen in other states that when the caloric content of the food is posted visibly at the time that the person orders food, people tend to choose foods that have fewer calories, in fact. So we've seen results.
Another part of this plan is workplaces, getting people who run those workplaces to get the better practices among their employees. Is this something you think can really come together?
I think it can. In fact, the wellness initiative, the workforce wellness initiative, has been in place for some time, and employers are asking for more, and this is why we kept it as part of the elements of the Mass in Motion campaign. We have different sets of guidelines that give essentially ideas to employers of things they can do to better the health, improve the health of their workforce.
And we know it's good for employees if they're healthier, but why would an employer be concerned about that?
It's a good question. We know that it cut costs, healthcare costs for employers, sick time, employees call in sick less, and so that turns into profit or into less loss, I should say, to employers.
Well, we should mention the website, because there's a pretty easy web address here, and if people go there, they can find a link to the blog, right?
Exactly. It's mass.gov/massinmotion, and right there is the picture of the blog. You can click on it. I should also mention that we have this website in Spanish, so there's a button for those who need information in Spanish. The calendar is there. Our email address is there. People can send us comments, postings, as I mentioned earlier, and this is it. This is the website.
Great. Thank you very much for being with us.
A pleasure.
From the Mass Department of Public Health, Jordan Coriza.